So how do you think patients, especially women, can better advocate for themselves in the system that seems to lack solid evidence and treatments?
I'm so glad you asked that. First of all, it's really important. So we women tend to be more timid, especially in our younger years. Not all. I have these badass friends. But I had no friends until I was 15. And so I was kind of a suck up and really wanted to be liked. And I worked on that. And now I'm a bitch to the deserving. But so, women tend to feel it's rude, more so than maybe men, to ask for a second opinion or to say, wait, I didn't understand that. But what I emphasize in the book is that you owe it to yourself, to your health, to stand up like that. And if you look at this is some of the stuff I talked about in a previous book, where it's like your feelings are not the boss of you. So yeah, is it uncomfortable to go over and, go pitch your idea to that guy? Yeah. Okay, can you survive a minute and a half of discomfort? I think you can. And so say you do that and you go over and you fail and he humiliates you or something. Okay, well, so there's a way to look at that. Small wins. You were brave. Yesterday you wouldn't have done that. Today you did it. You grew a pair. That is so cool. And the more you do that, the more you see that, the idea that something bad is going to happen is ridiculous and stupid. And then you get more and more brave. And so women with their medical care need to, and people, it's not just women, need to accept that moment of discomfort. It's not rude. It's actually you advocating in the most important way for your health. And so, you can say there's a thing called informed consent. So it's that you need to understand a treatment before you can agree to it. Well, uninformed consent is not a thing. And if the doctor hasn't explained it well enough, that needs to be explained to you, and it might take another appointment. Kaiser has these 20-minute appointments. You get the bum's rush maybe at the end. I find that doctors tend to stay with you if it's necessary. I don't bash doctors in this book. I feel that they're also betrayed by this medical system. Although I think, I get angry with the irresponsibility of gynecology doesn't know. Everything she said to me was wrong. And so with this, that you need to say, I don't understand this. I don't understand this. Can we make another appointment? And then there's 6 questions that I came up with because I think it's good to have them written down. I said, if you're like me and your memory goes into hiding when you're under the slightest bit of stress, it helps to have a list. You can put it on your phone. So these are the 6 questions to ask your doctor before agreeing to treatment. Can you lay out your reasoning behind your diagnosis and the treatment you recommend? Remember Dr. God? Because I'm the doctor and that's my clinical judgment, not an answer. And could there be other conditions that are causing my symptoms? They should do this thinking, but you can't count on them to do it. So when they give you these answers, that tells you how evidence-based your medicine is, or whether you're getting this sort of symptoms as disorders error from your doctor and your diagnosis. Are there risks from this? What are my risks from this treatment? Are there safer, less invasive alternatives? What can I expect during the treatment and what sort of recovery? And do I need to do this now, or could I wait or go without the treatment? And so, this is really important, and your doctor needs to explain this in plain language. And if they can't and won't, it's expensive for people to get medical care, but this is your health. And it seems to me, it's important to get a second opinion, if that's at all possible for you. It's really, really important. And to find another doctor. At Kaiser, you can just change doctors, which is great. I left Dr. God, and before him, there was Dr. God the first, these people who are covering for not knowing things or arrogant and treat you as if you're, disrespectfully as a patient. And you don't have to know the stuff that I know to have the evidence-based medical care. You need a provider who's going to be honest with you on these levels, or where you see the stuff that they're answering these questions using to answer, showing that this really isn't based in anything. And so you may need some time, to assess what they say. What people should do is also understand that their timetable is not yours. You don't have to make snap decisions. It's your medical care in your body. You can wait on it. Talk to friends who are, make good counsel, look things up. But you have to be careful because a lot of the stuff online, I know this because I know the science. You see stuff and it's just BS. And then the AI lies. And so if you don't know the medicine, I wouldn't use ChatGPT because it really just makes stuff up. And I use it sometimes because I need to remember what was the thing? Which part of that? What's it called? And then it'll remind me and I'll know if it's wrong. The horrible thing about this is that basically my friends Gary Taubes and Nina Teicholz were some of the first people writing these low carb books. And then Michael Eads and Mary Dan Eads were providers in Arkansas, helped like 10,000 people get unfat. So all these people, launched this a low carb wave and explain where the science was bereft in the medicine, where it was missing. And I do this in perimenopause and menopause. And the truth is, we really need outsiders like me, or can even be an insider if they have an objective view and are willing to look at warts and all, to take on these subjects and say, here's where the science lies. Because I tell you, every area, I did not need this lesson in the endothelium area. This is my eyesight. I have been so sick for like a month, and I had to fight for tests that I know I need. I had to get the head of endocrinology to prescribe the test for me because the other gynecologist or endocrinologist said they didn't have this test called the synecdothine test, where they stimulate your, basically they want to see what your cortisol is doing. If you're, a hormone from your pituitary can get your cortisol out of the grid. And, and so the idea that a facility like Kaiser wouldn't have this with all the diabetic and very sick patients they have. I mean, if it's a outhouse in a cornfield in Idaho repurposed as a medical clinic, okay, I believe it then. Of course they have it. I mean, and this is the kind of thing that you deal with. And unless you have the information on the other side, which books like this can tell you, Gary's and Nina's, with appropriate skepticism, it's sort of like you're screwed. Like, I don't know hematology, that's blood. I know a little bit about it because I know the immune system. So that's an area where if something happened, I would need massive amounts of reading, but I can't do that. That's why we need books like this, because it gives you some idea. And I want to just warn, though, there's a thing I call amazeball science. Like, oh my God, it's so fantastic. This thing, it just like, your cancer will become like, butterflies and fly out of your brain. It's just the perfect, great, unbelievable, quote unquote science. And it's really important to look to see that somebody is skeptical. For example, Gary Taubes, oh my God, he's the most nervous person about concluding anything. And so he's my scientific big brother because he's a great role model for not making unwarranted leaps. And so I looked to him as a role model for that. And then, who else was I thinking? But so in my book, it is so disturbing to me to not give women answers because we're all afraid. So in the breast cancer chapter, I at the end, I say, I'm really sorry. You want to have this answered. So does estrogen cause breast cancer? And the research is to what's called heterogeneous. This group of women was tested with this drug and that drug and everything. And, there are just so many problems with it. We just can't conclusively say. And so I tell people, where I lie on this, I have a risk of breast cancer, but women, 1 out of 5 women will die of heart disease right now. And very soon, 1 out of 3 breast cancer usually die of heart disease. And like 90% of breast cancer is curable. That's horrible disease. You don't want it. Chemotherapy, it's just ruinous and horrible. But what's most important, if you have to have a trade-off for me, and everyone cannot just follow what I do because this is me taking account my individual health metrics, and most people help them with that. Oncologists are actually the one doctor that can probably assess risk better than the rest of the doctors. Really are not good at it. And, I'm able to do that, but the answer isn't just follow what I do, but to make a reasoned decision with somebody to help you about where your individual risk lies and where it's important to in terms of trade-offs.
So you've said you don't write for saints of discipline. I really love that statement.
I write for the mere mortal like me. My friend Steph says I'm not lazy, but I am a lazy hedonistic pig. If I have ice cream in my house, my little Amy Alkon snout will be right in that. It's going to just dive. There will be none left. And so I just work things out so I'm able to have doable initiatives for my health. So this is something as an advice columnist that was a real big part of my practice. First of all, I never gave advice. which is funny as an advice columnist, but if you tell people what to do, it causes psychological reactance, and so, which is a rebellion. But so when writing my column, however, I would, there'd be the thing that I would say would be like the third paragraph, like near the end, where it would be, a suggestion of like, you might do this, or, this is a way to something. I put it in those indirect terms. Excuse me, I almost sneeze. Okay. Maybe I'm not going to say false alarm. And so what I would ask myself is like, hey, Alkon, I think there was profanity involved. Is anyone going to do this? Is anyone going to keep doing this? And if the answer wasn't yes, well, it's like, well, you idiot, go back to the drawing board, jerk. And that's the thing with, the how to eat and how to exercise. And when I talk to people, I do private sessions with people. I have no qualification. I'm not a trainer. But I'm really good at this because I have one session with somebody and I help them fix things and figure out how they're going to fail and manage all that psychologically and otherwise. But, it's this thing of like, well, okay, who are you? What are your values? What works for you? So I talked to my agent about, ways to eat, but she's this kid's teenage boys, gorillas, like a buffet. And they eat so much food. So she makes chicken thighs for them because it's like you can afford them. Like for children who would eat insane amounts of food. And so I don't eat chicken thighs, even though they're so delicious because they're very high, sadly, in omega-6 fatty acids. And you want to have more omega-3, and that's in the salmon and other things I eat. But so, I quit them, but, so she needs to still serve those. And there are people who are just not willing to stop everything, or they want to go out for drinks and, and still live a certain life. So you work things out for them, what's doable. And you also help people manage failure. We all fail. We suck. We just, we mean to do something and we don't quite do it. And then we feel really bad. And the important thing is to have self-compassion for when you fail. You're going to fail. And so you need to accept that. It's not, that you're a horrible person or anything. This is just being a human being. And I like the self-compassion thinking of Kristen Neff, who's a researcher in that area, where she says, your failures are what connect you to other humans. And so that sounds like the thing is our brain, it's really, like I said, kind of dumb. You can just tell your brain a story and it'll believe, and that's how they implant memories in these people, whatever, and crazy stuff. And, repeat the story and you repeat it and it becomes real to you. But so that's really important. And then, to have, for example, systems instead of goals. A goal, and this is also in my last book, systems are things that are overreaching, strategies. I'm going to take care of myself in later life and live this wonderful, robust life. I'll be me, but just a little more, in need of iron, and not suffering and sick. And so that's the system. And the goal is, well, I'm going to eat perfect day, or I'm going to, I'm going to hike 20 miles or something like that. And if you don't do that, then you fail. You can fail, at meeting your goals, but your systems are ongoing. And so that helps you sort of amortize failure, and then also the other thing is that when you do that, that helps you not just say, throw up your hands the way people stop going to the gym. Oh, I didn't go yesterday. I wasted some money last month. I'm just not going to go because I feel bad about not going. And just be honest about that and laugh. I laugh at what a ridiculous, fallible, dummy human I am. Those things you do where you think like, oh, I bet that is still good, that food. And then you're like over the toilet. These things where you knew better. You knew better not to open that thing that you knew was going to like explode all over the counter with like the dog kibble, and so laughing at that helps you not be such a recriminating, hard person on yourself. And then to really work out, well, can you do this? How do you make this doable so you're not feeling like you failed? And then do you want to extend yourself a little and do a little more and a little more? And the thing about building habits is that the more you do it, first it's uncomfortable. The more you do it, the more it becomes normal. And so like for me, I had to stop eating bacon because I needed to go SWAT team on inflammation because of this corneal endothelium transplant. And so the first day I had herring with butter that I heat in the microwave. It's actually quite good. The smoked herring, little tins, inexpensive on Amazon. I was sort of like, well, this is kind of a bummer. But then I'd done it and I was sort of like, well, this is tasty and like, okay, whatever. I have those pork rinds. I still have 2 of the big jars I ordered that are up there. They look at me. I'll take them to a party so I don't. because it's more important to me to not have inflammation. And so it's these sort of things, that are important to do, like to be forgiving to yourself, but also to set up habits. And there's this great advice from Mary Dan Eads, one of the authors of Protein Power. These two doctors, they're my friends. They're really great on evidence, and, the low carb, they're like the first, along with Dr. Adkins. And she says to her patients, or when they were practicing in Arkansas, okay, I want you to try something. You try this for 2 weeks to be faithful to a low carb diet, just for 2 weeks. And then if you don't like it, be disciplined, be faithful, then you can stop. And this is what happened with me. We were taking the book cover photo for I See Rude People, which was 4 books ago, not many books, because it's a painful process each time. So I had, as I mentioned, my snout in a vat of ice cream for all of March. And I was like, uh-oh, a camera adds 10 pounds. And so from being friends with Gary Taubes, I knew that I could just lose weight if I just cut out everything but meat and eggs and black coffee. And I did. But also I felt so good from this, that I just kept going with it. And that's the thing, how habits start. You get used to it. And you just accepting the discomfort is just such a big part of it. And I like to talk to myself. It's there's a friend there and it's funny. The thing of come on, don't be such a wussy. You can do this. Okay, whatever. And that's really to have things be amusing and not just grim. That really helps too. So these are some of the ways where you can make exercise and diet work for you, that maybe you're not going to go to 100%, but maybe you go to 65% or 85%. And then maybe you try going a little further. And the more you repeat a habit, there's a line, neurons that fire together, wire together. It's actually Carlos Schott's, I'm paraphrasing Donald Habib, came the original. I love that though, because it's very descriptive and important. It's that when your neurons, in this neuron, you do some action, this neuron fires, and then you do some other action, this neuron fires, and then they begin firing at the same time. And then the set of actions becomes sort of automatic. And so this is a very important thing to understand in terms of your habits become habits. The things, the actions become habits. And so it's also the social support you mentioned. This is such an important, when you tell other people you're doing something, you don't want to be a liar. So you're more likely with the eyes upon you to follow through. And also it really helps if 2 people are doing something, if they're, I write with my friend Steph and Moon, write on Google Hangout, my computer on mute. And I just look back at my finger. It's so sexy. And they'll be doing their little writer things too, and I'll work more because they're there. And my friend, I had been yelling at her to do weight, do this slow speed weight training. And so she got her husband to do it with her. Now they're going to the gym and they're building, lift do 10, go upstairs, and they sometimes do more. And so this is now socially supported. It's something that they do together. And this really helps. So all those things that can help you manage habits. Another one, this one from my friend Art Markman, who's a psychologist. It's just great. So I wasn't taking my vitamin D in the morning. I was forgetting. And so I thought, okay, let me take Art's advice, which is build a habit into your environment. So how do I build that in? Okay, the first thing I do in the morning, grind the coffee beans. So I put the vitamin D bottle in the coffee beans. So I had to go through the vitamin D to get to the coffee. And so I, in less than a week, I thought about that. I remembered, I woke up, got to take my vitamin D, and it became a thing. And so those are some of the things that we use to get around, our mere mortalhood. And recognizing that really helps. You have to know that you're screw up in order to deal with it.